Hi, I'm Dr. Rob Cavoto. I'm with Upper Darby Pain Management, the Healthline Centers, and we are the relief you seek. A lot of the times people walk through life with headaches. They become so used to it that they just accept it as part of life. I was a victim of that when I was younger, and I went over that in an earlier video as to how I became a chiropractor and why. But the fact is that headaches in many cases can be due to structural imbalances, can be due to toxicity in your body, can be due to problems in your jaw. Many things can cause a headache. Particularly when you start talking about cluster headaches, you start talking about migraines, you start talking about pressure headaches. You may not know those terms, but if you have them, you know them. And if you hear anything here that sounds to you like you have that, well then you really do need to come see a chiropractor or somebody like myself who's a chiropractor and a cardiopath who's studied extensively the joints, muscles, and bones of the skull and the jaw. Now, what is a cluster headache? Cluster headaches are headaches that come literally in clusters. And if you have them, you'll know when it comes, you're in for a few days of a problem. All right, now can we help that? In many cases, yes. In many cases, we can deal with that nutritionally as well as structurally. What's a migraine? Okay, a migraine is when you become photophobic. Photophobic means light hurts your eyes, and sounds hurt, and everything hurts, and you can feel it behind your eye. Now, migraines many times are caused because of vascular constriction in your neck into your skull and into your brain. And we've been able to help that along with the use of nutritional therapies, along with the use of chiropractic and craniopathy. So if you have migraines, and many people do, it's time to get it looked at from a biomechanical standpoint, not just a medicinal standpoint. Because a lot of times the biomechanical standpoint will be able to eliminate them completely or reduce the intensity of them. It's never a guarantee, but the success level is very high. And if you have a pressure headaches, which are stress-related headaches, we can deal with that on several levels. Structurally, nutritionally, as well as we use hypnosis for that in order to develop a greater resistance to stress or teach you how to relax upon your own desire to relax or command. Everything said and done, a headache isn't something you should live with. We need to get it checked out to make sure there's not a larger problem. But if it's not a much larger problem, it's a problem that can be handled and can give you the relief you seek, which is what we do. Now, if you have a headache and you have neck pain, or if you have a headache and you have sinus problems, because there are sinus headaches too, there are things I can show you to do to alleviate a sinus headache. Believe it or not, a lot of the times we do something called electric stim, which is a very gentle electric impulse into the sinuses that open up the gateways that allow everything to flow and get rid of the problems with the allergies or whatever it is on a temporary basis. Now, I'm not saying medication, particularly when it comes to sinus headaches or allergy headaches, aren't needed as part of it. But a lot of the times what we do will help get rid of the problem and diminish the pain. You're still going to need the medication your medical doctor gives you. But what we give you is as essential in order to put them off for as long as possible and to pull into health as quickly as possible. I can be reached at 1-833-TELL-ROB. 1-833-TELL-ROB. And remember, with headaches, we are the relief you seek. Thank you.